Now it's time for tip-episodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Hey, Dr. Shamardi, how are you today?
Very good, thank you. Glad to be with you.
I'm so glad to be with you too. I'm Tanya Dunlap, for those of you listening, with Perio Protect, and I am here with Dr. Sam Shamardi, a periodontist based in Boston, Massachusetts, who's been prescribing Perio Protect since 2021, and we're going to get some good insights for how he uses Perio Protect specifically in his practice. So, Dr. Shamardi, tell us a little bit about yourself.
Great. Yeah, really excited to talk about the product. Again, my background, as you mentioned, I'm a periodontist, board certified here, practicing in Boston, teaching at Harvard with the Perio residents for about 14 years on top of being full-time private practice, doing a lot of speaking, of course, how we came together, and especially very proud to be a KOL speaker on behalf of Perio Protect. And really just a big believer in the product and the differences made for my patients day to day.
We're very proud to work with you also. As you know, clinicians who know about Perio Protect and prescribe it, there's so many different kinds of patients who can benefit, from gingivitis to periimplantitis. As a periodontist, you're not going to see very many, gingivitis patients. But to tell us, please, how you use and why you prescribe it for whom.
Yeah, I think one of the biggest take-homes, and I always mention this in all of our programs as well, what makes Perio Protect unique, I call it a Swiss Army knife product. It's so multifaceted. It comes in all different phases of treatment. This is a product that could be used in phase 1. It could be used in conjunction during phase 2, or also just long-term for phase 3 therapy. So for me, what makes this product so valuable is that there are so many different areas where I can introduce this, and there's so many different avenues in which I can describe what it's going to do for the patient. And the results that I'm going to get are always going to be beneficial. So what's really important to note for any clinician that's hearing about this for the first time is to just understand that this is a product that is so simple to use, requires such little education for the patient, and of course for your practice doesn't require a whole lot of work and basically no overhead as well. And again, most importantly, the outcomes that the patients get are so positive that whether it's a patient who's very dental phobic and does not feel comfortable moving on with a more involved phase 2 procedure, we've got patients who are so scared, forget about phase 2, they don't even want to get scaling and root plane. Right. And it could be, we think of this product, and it doesn't have to only be for very involved periodontal cases. You can have everyday patients that come in who just have, high levels of bleeding on probing and nothing more than gingivitis, but whose home care is either not ideal, or who are just having a hard time getting control of that, inflammation that's going on. And you're going to see incredible changes with those patients as well. So again, it's just really important for me to emphasize that what makes this product so unique and so beneficial is just the ability to use it in all the different type of, treatment scenarios.
That's right. And Perio Protect has been around for 20 years, but there are still some people who are just learning about it. So if they don't know how this prescription tray that doctors like you prescribe for home care is actually used, could you tell us how you might explain this to a patient? Because I think that'll give a good overview.
Yeah, I think with my patients, typically what I'm doing, again, depending on in what phase I'm introducing this, I'm describing the product as being very simple. It is as simple as a tube of gel, which is 1.5% peroxide. It literally looks like a tube of toothpaste. So it's easy enough to be able to show them and describe them that. And then, of course, the only other component is the tray itself, which is clear, which is very soft and comfortable and easy to wear. And of course, the compliance win for us with our patients is that this product is able to do the job for us in a period of as little as 10 minutes per day of use. So I'm able to describe to my patients, listen, with this soft, comfortable tray, you only need to apply a little bit of peroxide within the tray itself, And all you need to do is put that tray on for a period of 10 minutes. And during that 10-minute time, it could be at any point during your day, and you can be doing any kind of activity. So rather than having to come into the office or have some kind of fixed period of time, I have patients that wear the tray when they're walking their dog. Have patients that wear their tray when they're watching TV. I've actually had one patient tell me that, when they take a shower at night, that's kind of when their time is to wear the tray as well. So, it's a very, short 10-minute period to use. And yet during that time, because of the way the tray actually works via the deep delivery, it's going to be pushing that peroxide gel underneath the gingival margin. And we're going to be able to see this dramatic change again in reduction in inflammation. It's going to attack that biofilm. And what patients are going to find as they start wearing it in a very short period of time, their mouth is going to feel considerably cleaner and fresher. And when we bring them back a few weeks later to just make our own clinical evaluations, we're seeing a change in, tissue color, tissue tone. We're seeing a drastic, if not full, reduction in bleeding on probing. And there's just yet to be a patient that has not benefited. And the beauty is when they come in, because there are going to be positive gains for them, now they are that much more, happy with the result and that much more open and willing if they are a dental phobic patient or need additional therapy. Well, now they're that much more willing because they're thinking, okay, I'm at this practice that has introduced me to something that was really simple, was very comfortable, didn't hurt, didn't take time, and I'm seeing really tangible results. So now I'm a whole lot more open and willing to hear what else that they want to suggest for my treatment.
This is great for people who are trying to figure out how Perio Protect works, and also, should I prescribe it myself? You have described Perio Protect as working for a range of your own patients. Can you think back to 4 years ago, though, when you weren't exactly sure yet if it was going to work? I want to be clear to people that this is home care, that you always combine this with your in-office procedures. And that's when you combine the two, that's really where the magic is, right? We get that benefit.
Absolutely. And, to not confuse anybody, this is not in lieu of regular traditional treatment. So, this isn't a miracle where patients are going to wear a tray, do nothing else, stop brushing, stop flossing, and stop coming to the practice. However, on the flip side, if our patients are doing their brushing, flossing, they're coming into the practice for us to do our role, but they're, adding this as their home care routine as a supplement, that's where they're going to see the big gains.
Yeah. And are you doing any less surgery than you were doing before Perio Protect?
Again, depending on when I'm introducing this, and we'll, of course, I'm sure talk about the implant side and kind of the maintenance side of things. If I'm doing this as a pre-surgery type of procedure, what I'm really just seeing is when I'm going into those sites, again, the overall inflammation that I'm entering and really the condition of the tissue are just so much improved. So, if somebody comes in and has periodontal disease and has a quadrant or an area that has 7 or 8 millimeter pockets, that pocket isn't going to vanish from the tray. So I know I'm still going to be at some point doing some kind of, phase 2 osseous pocket reduction, or whatever procedure I need to do. However, I'm able to enter that site in a much healthier and more, reduced inflammation and bleeding. And again, what it's going to do for that. And then in the long term for the maintenance side, is really making a noticeable difference in those outcomes.
And do your patients give you any kind of feedback about trays, about their use?
Yeah, it's actually been pretty interesting to see that for the patients that I've been using this for now about 4 years, there actually has been yet to have been one patient that has used these trays that hasn't come back and said that their mouth feels cleaner and just fresher. They can't pinpoint exactly what or why. And that's okay. And, that's our job, not theirs. But they are all coming back and saying, things just feel better. And ultimately for us, that's what we want. As long as our patients see that, that's a huge gain for us.
Yeah, I personally enjoy it too. There's something that I call the Perio Protect clean that you just didn't know you could get that clean before this. So let's talk about your use in implants. You and I have been working pretty closely for a year, testing out some tray designs for implant patients. And the idea, of course, is to save natural teeth whenever we can, to save implants when we see infection around them, but to prevent peri-implant mucositis also. Talk a little bit, please, about your use of Perio Protect for your implant patients.
Yeah, from the implant standpoint, it's interesting because the whole implant abutment interface is so different than what we have going on with natural teeth. And the way the tissue fibers are typically around implants, the tissue is just more permeable. That gingival margin is more permeable.
Right.
You're going to see a different type of connective tissue attachment, which results typically in more inflammation. So a lot of times we'll have patients whose home care might even be good, but we kind of just see that low grade bleeding on probing inflammation when we're probing around those areas. So what's really important and a huge asset with Perio Protect is, we tell our patients that, listen, you've invested obviously a lot into trying to, get new teeth, for lack of better terms. And, it's difficult to maintain them. And, why not introduce these trays as a very simple, again, long-term at-home maintenance treatment for yourself that's just going to help keep those implants that much cleaner. So what we've started to do, and we've done it as early as during the healing phase. So, if teeth are being extracted while they're healing, we've obviously seen that those sockets are healing that much better and the outcomes are that much healthier when we are incorporating tray therapy. When implants are placed, if they're going through a few months of healing with a healing abutment, for example, we're able to aid with the tissue condition during that period, which of course is important. And then again, once our patients have their final prosthesis on, and again, for this long-term junction, now they have something that they're able to incorporate that, again, is just going to help them keep the condition of their tissues so much better. And really, that's what it's all about in the long run, with teeth, but especially with implants. It's all about trying to manage that biofilm and keep that inflammation down to a bare minimum. And so if we have a tool like Perio Protect that is able to, be yet another asset working on our behalf in trying to minimize that inflammation that's going on there, that just is going to, improve outcomes and reduce the amount of peri-implant cases that are going to be coming our way.
Well, I want to just thank you for all this time that you spent here with us to share your own experiences with other people. If they want to find out more about you, what's the website where they can go and learn about you?
Yeah, they can go to on Instagram. The social media handle is at Dr. Sam Shamardi. They can also go to my personal website, which is www.drsamshamardi.com. Or at the same time, I have another site for a masterclass program that we've launched, teaching surgery skills and a mentorship program. So that website is www.masterclinicalsurgery.com. So three different areas where we can.
All right. This is terrific. And that Master's Clinical Surgery is fairly new. You launched it a couple months ago, right?
Yes. Just launched it and really, really excited. We've had a lot of interest for it. And again, it's unique to provide a program that rather than one-off training is actually a multi-month program with continued lessons, mentorship, a network and lessons. So really for anybody looking to advance their skills and learn some new tips and tricks from the specialist standpoint, that's a great place to go.
I think that mentorship opportunity is just so special and valuable. It's really, exciting to have you do that.
Yeah, looking forward to it and hope to, hear from some people out there.
Excellent. Okay. So if anybody wants to learn more about Perio Protect, you can go to perioprotect.com/4u, FORYOU. And we look forward to hearing from anybody about their comments. Thanks so much, Dr. Shamardi.
Great. Thanks so much.
A tale of two hygienists.